Strongyloidiasis. Strongyloidiasis is a parasitic infection, that is threadworms, caused by Strongyloides stercoralis. Strongyloides. Strongyloides stercoralis. Stercoralis. Strongyloides stercoralis. It is present in soil and it is a lymphatic disease transmitted into the tissue. It's found in tropical and subtropical countries. It has two way of cycles. One is free living cycle, another one is parasitic cycle. Parasitic cycle happens in the human body. From the soil, the infected filarial form it goes into the human from contact with the soil. Through the skin, it goes to small intestine, develop mature parasitic adult female, only female. This female without matting, it goes parthenogenesis, that is embryo occur directly forms eggs, and there are two ways in that. It will hatch egg in the human body and becomes filariform larva, and then auto-infection occur again. The second way is it is deposited in the intestinal mucosa, hatch eggs and goes out with stool, and it starts the free living cycle. In free living cycle, that is outside in the nature environment, there will be male and female worms will occur, then matting will happen and it hatch eggs and larva in the soil, it will be present. This parasitic cycle in the human body is called filariform infective larva. When it happens on free living cycle, that is called rhabdidiform larva, that is rhabdidiform, rhabdidiform larva. Symptoms: mostly it is asymptomatic or life-threatening infections will occur in immunocompromised host. It enters the skin and causes subcutaneous rash with itch, urticarial rash. Intense pruritus will occur for 3 weeks. Papillovesicles also appear. GI tract, there will be watery diarrhea, mucoid diarrhea, abdominal pain, crampy, weight loss, malabsorption, steatorrhea, pruritus, ani, bloating, malnutrition. Respiratory wise, cough, non-productive, blood while cough out blood, dyspnea, wheezing, fever, eosinophilia, pneumonitis, and in immunocompromised patient, hyperinfection syndrome occurs. Life-threatening case, severe presentations with GI, respiratory and dermatology. Fever, bacteremia, septicemia, E. coli and Klebsiella, hyponatremia. In respiratory wise, pleuritic pain, ARDS, hemoptysis, pulmonary effusions. In GI tract, ileus, small bowel dilatation, strictures and ulcers will happen. Risk factor for this strongyloidiasis or corticosteroid therapy with other suppressive drugs, patient with diabetes mellitus, AIDS, acquired immunodeficiency syndrome, CKD, chronic kidney disease, elderly age, malignancy, chronic alcohol consumption, human T-cell leukemia virus type 1, that is HTLV1 infection. These are all the risk factors. Diagnosis made by stool, ova and parasites. If less than 1 month after the initial skin infection, 3 consecutive days of stool must be examined. Blood work, eosinophilia, anemia to be ruled out. ELISA test, PCR count, chest X-ray, CT scan, endoscopy, LP and skin biopsy will help to rule out this disease. Treatment: this is very difficult to eradicate. Quickly taper any pre-existing immunosuppressive agent. Vermectin 200 microgram per kg per oral for 1 to 2 days. Second one, albendazole 400 micrograms per oral BID for 7 days. Blood spectrum antibiotics, broad spectrum antibiotics for 14 days treatment. Stool examination after the treatment, that will be taken after 6 months and after 12 months. Prevention, wear protective footwear in endemic areas. Example, walking on barefoot beach on soil can cause this infection. So sanitization of hand hygiene must be followed. Thank you.